welcome to tonight's IER and Hazard Zoom. My name is Carolyn Jones. I'm the Director of the Institute of Employment Rights, and for those of you who don't know us, we are a trade union-backed think tank formed of a network of academics, lawyers and trade unionists. Frequent watchers of our IER Zooms will know this is by no means the first IER Health and Safety Zoom since lockdown began in March 2020. In fact, our very first event was on health and safety. That one was called Building Not Burning Health and Safety Regulations, and that title was aimed at reminding people of Boris Johnson's promise to have a bonfire of regulations post-Brexit. Unfortunately, Boris is still around and his threat has not gone away either. Indeed, it gets closer by the day. Invariably, the current pandemic has sparked a massive increase in how best to protect the health and safety of workers, and so it should. Securing the life, health and well-being of workers is surely a basic and fundamental expectation. Unfortunately, that expectation is too often not met. And this pandemic has shone a spotlight on the failure of the government and the failure of our labour laws to deliver on those basic expectations. The pandemic has also shone a light on the failure of our enforcement bodies to adequately enforce the laws that do exist to protect workers, and their failure to monitor and correct the behaviour of both government and employers, which takes us on to our topic tonight. Who is regulating the regulators? So consider the situation. With Parliament, denied the right to debate government legislation on proposals on COVID, with government refusing MPs and pressure groups the right to scrutinise the millions of pounds worth of procurement contracts being awarded to inappropriate companies, and with the HSE failing in its duties in at least 3 ways to improve government guidelines sent out to employers, to protect the health and safety of workers, to monitor the safety of workplaces before and after workers are forced back to work. Against those problems, asking who's regulating the regulators is a very timely and important issue. At the Institute, health and safety has always been an important aspect of our work, and we have a cracking team of health and safety experts who give generously of their time and knowledge to inform our work. Our Manifesto for Labour Law has had a specific section on health and safety, and we believe it's important to continue to push for those proposals. We don't expect the current government to enthusiastically embrace our ideas, but we sincerely hope that the Labour Party, even under its new leadership, continues to recognise our proposals as not only progressive, but also popular and very much needed. There will be links to past IER work on health and safety and our manifesto posted in the chat box and on the final closing slide. Most of our health and safety experts and a few more who have joined us more recently are currently working on a new IER health and safety project. That project is in 2 parts. The first is to learn from our COVID experience and draft what we're calling a mini manifesto on how to do things better in the here and now. And the second part of that project is to build a framework of health and safety law that will better reflect the workplace and the working relations of today and tomorrow. COVID has shown us just how quickly those circumstances change. You only need to think about home working. Yet our current framework of law is built around the world of work as it existed 50 years ago. It needs to change, and IER are working on proposals to make it change, but more of that in the future. As an aside, one of our new health and safety team, Phil Taylor, is conducting a piece of research on who, how and why people are working from home. A link to his research is or will be in the chat box, and I'd encourage you all to try and participate in that. The more people who complete the survey, the better informed Phil's research will be, and the less able those in power will be to ignore it, fingers crossed. So back to tonight, we have 3 excellent speakers and only 1 hour to hear from them, so I'll move swiftly over to our speakers. Our first speaker tonight is Steve Toombs. Steve is Professor of Criminology at the Open University. Steve is one of the team of health and safety specialists who has worked with IER over the years and who gives so generously of his time and knowledge. He writes IER publications, he speaks at IER events, and he's now engaging in our latest health and safety project. Steve is a master of statistics. His information on health and safety funding cuts, the number of visits and enforcement notices pursued by the HSE is second to none. Plus, Steve is brave enough to bring some slides along tonight, which is another first for an IER Zoom. So welcome to Steve.
Thanks very much, Kat. Just make sure that you can see the slides. Okay, I'll take silence as a yes. So look, thanks to Cad for the invite. Thanks to James and Sarah for getting this on tonight. And thanks to all of you. I know that by this time of night, most of us are zoomed out, so I appreciate your kind of time. What I've got to say actually draws upon various bits of writing that I've been doing through the summer about the pandemic and its management or non-management. I think James is going to post some of the links to that work. So I'm saying nothing new. I've made a career out of saying nothing new, and I'm going to carry that on tonight pretty much. So look, my story begins on a Sunday night, the second Sunday night in May. It was about 8 o'clock in the evening, and Boris Johnson went on TV. At the time, there was a 7-day rolling average of about 400 deaths in the UK a year from coronavirus. But Johnson urged people the next day on Monday morning to get back to what he called Covid-19 secure workplace. He wanted people to go back to work. He wanted the lockdown, as he put it, to end. The next day in the House of Commons, he announced that the HSE would be, quote, having spot inspections to ensure businesses are keeping employers safe. And at that point, he pledged £14 million of additional funding for HSE. So this was Johnson's kind of fantasy island of workers rushing back to COVID secure workplaces, one of many fantasies that he and his government have unleashed on us as a population, for which many of us are paying and will continue to pay for many years to come. I just want to enter some kind of realities to that fantasy in the next few minutes. We're going to have 3 sets of realities. The first set of realities is about the so-called lockdown. And as we know, many workers had never stopped going to work. Many workers never enjoyed, if enjoyed is the right word, any form of lockdown. So we all know that there were essential workers, a group that we recognised as covering not just health and social care and emergency services, but also transport and shop workers, those in the food supply chain, cleaners, postal workers, refuse collectors. None of those stopped working, nor did workers in call centres, security workers, and those in other diffuse areas of the gig economy, and nor did most workers in construction, certainly not in England at least. Building workers were forced to go to work, despite an heroic campaign to shut the sites. Employers and the government ensured that as many workers continued to work as possible. So lots of workers never experienced a lockdown. So Johnson's message in May was almost irrelevant to that point. But of course, we also know that many of those people who went to work during the height of the health crisis, lost their lives as a result. So in May, around the same time as Johnson's announcements, the Office for National Statistics revealed, and you'll remember this, men in low-paid manual jobs were 4 times more likely to die from the virus than those in professional occupations, while women working as carers were twice as likely to die as those in professional or technical roles. So working people paid the toll for the failure to shut down significant enough sectors of the economy. The point I want to make about who's regulating the regulators, the first point is that the Health and Safety Executive and Public Health England were complicit in that illusion of a lockdown and complicit in some of those unnecessary deaths. Most of those workers who went to work weren't protected by the HSE, nor by local authorities, even in workplaces where social distancing was necessarily, if not patently and consistently, ignored. I'll give you 2 examples of this before moving on. Building sites. Something called the Construction Leadership Council sounds independent, but actually is part of Department of Business, Energy and Industrial Strategy, BIS. The Construction Leadership Council produced a series of different site operating procedures during the summer, during the pandemic. And these were regulations designed to manage so-called safe working for building workers. And they produced 5 different sets of these guidelines, these site operating procedures, all with the explicit support of Public Health England and the Health and Safety Executive. And each of them relaxed restrictions on building work because it was clear initially that building workers couldn't maintain in the first version 2 meters social distance. Then they couldn't maintain 1 meter social distance. Then in the third version, it was recommended that, okay, if they couldn't maintain social distance, they could building workers could work next to each other, but not for longer than 15 minutes. And then it was changed to, well, okay, not longer than 15 minutes if they were breathing in each other's faces. And then the 5th version just said, do your best, lads, but just work as normal. So each time the failure to ensure a safe workplace meant not changes to the workplace, but changes to the regulations which govern safety in the workplace. A similar thing happened, as you'll recall. So much has happened in the past few months, but you'll recall the furore really in mid-April when Public Health England, with the support of HSE again, issued new guidance on the use of PPE, quote, when in short supply. And it recommended that face masks on the front line by health and social care workers could be reused, could be washed and reused, as could other PPE. This superseded another change in advice, which had happened a couple of weeks before, where it said that PPE didn't need to be changed after a patient had been treated, but only needed to be changed at the end of the shift. Again, what was going on in health and social care settings, overseen by Public Health England, overseen by the HSE, was that where work proved that it couldn't be done safely, the workplace and the job wasn't changed. What was changed was the definition of what constituted safety for that group of workers. So in those deaths, I would argue very clearly, Public Health England and HSE were partly complicit. The second set of realities was about Johnson's claim that there will be on-the-spot inspections in the workplace. Now, for a long period of time, both independently, also with my colleague and friend David White, also with Phil, who's here tonight, Phil James, also with David Walters at the Institute, I've tracked enforcement trends, enforcement activities and enforcement capacities in terms of health and safety at national and local level. And what you see very clearly is from about 2004-5, but then much more clearly from 2010, when austerity hits, considerable declines in all forms of enforcement outputs and capacity on the part of HSE and local authority regulators in respect of health and safety at work in the UK. That's very clear and has been documented in a whole series of publications within and out with the IAR. In the early months of the pandemic, in April 2020, a series of papers were lodged in the House of Commons libraries about HSE's activities in the previous decade or part of that decade. And there were 3 of those indicators just on the slide there. You can see that funding fell significantly during that decade, fell by £104 million. Bear in mind, in the wake of that £104 million cut, Johnson had offered £14 million for the new spot inspections for the new COVID secure workplace.
Steve, sorry yes. to interrupt you, but the screen isn't showing. We have put them in Dropbox, but I'm not sure people will be able to. Can you press the screen share again and see if it works?
Yeah, I can. Yeah, let me go back. It's been shown before, right?
No, I just didn't like to interrupt your flow. You were doing so well.
Should have. The screen share is on, right?
There you are. It's coming up now. Brilliant.
Okay. I'm really sorry about that, folks.
Don't worry.
I'm not worried that much, but I'm a bit sorry. Okay, sorry. Yeah. Okay. So what I was going about, it helps to have the numbers on screen. Thanks. That's useful. And the last of those bullet points there is you can see that over that same period from 2009 to 2018, that the number of inspectors dropped from about 1,500 to just under 1,000. Again, a fall of just over 30%. And again, that kind of masks the seriousness of the decline, because not all of those inspectors will be what we understand as frontline inspectors who do most of the inspecting for most of the time. Also around the same time, spring 2020, as those figures were deposited in the House of Commons Library, Martin Temple, who was then chair of the HSE, was given evidence to a DWP select committee. And he said in that evidence, and I quote, "We do 20,000 odd," by which he meant inspections of workplaces. "We do 20,000 odd or something of that order, and we have about 5.5 million duty holders, right? 20,000 health and safety inspections in any one year, with a population to inspect of about 5.5 million employees as a translation of employers, as a translation of duty holders." What that means, if you do the maths, is that the statistically average employer, and of course there's no such thing as the statistically average employer, but bear with me, the statistically average employer could expect to see an inspector once every 275 years. So the prospect of seeing an inspector once every 275 years doesn't really constitute an on-the-spot inspection, which might secure the COVID secure workplace. The third set of realities, and I'll conclude shortly after this, is with inspection and enforcement at a local level. So as you'll all know, a significant amount of health and safety law enforcement is undertaken not by HSE, but at a local authority level by health and safety environmental health officers. I mean, again, part of my work over the past 5 or 6 years, or a bit longer maybe, has been to focus in at local authority level, often ignored actually, to look at the extent to which regulatory capacities have become diminished, and they've really been cut to the bone. So for 3 years, for example, in the city of Liverpool, where I live, for 3 years in the city of Liverpool, in the mid-2010s, there were no health and safety EHOs at all, nobody to do anything inspecting. There are still local authorities across the country where there are no EHOs who are qualified in health and safety, and there are many local authorities across the country where there is less than one full-time equivalent health and safety EHO, less than one full-time person whose job it is to oversee health and safety enforcement in all the premises that are supposedly regulated by the local authority. We also know that the central government has put in place barriers to enforcement over the last 10 years. In 2011, it arbitrarily defined a whole swathe of workplaces as low risk, didn't provide any criteria as to what constituted low risk, and that immediately exempted those workplaces from proactive inspections. And it also set in train something called the primary authority scheme. The primary authority scheme is a fairly esoteric and technical device, but what it effectively does is it allows companies who operate across more than one local authority area, so certainly any company of any size, and certainly large multinational retail outlets and so on and so forth, stores, it effectively creates obstacles that are being enforced by local authority regulators through a contractual arrangement which involves an exchange of funds, and therefore creates disincentives for enforcement. Happy to talk about that in the questions. And lastly, we've seen both creeping, but also in some cases whole-scale privatisation of regulatory services at local authority level. So think about that. We've got law designed to regulate private businesses, which has now been outsourced, privatised by contract to private businesses, including some of our friends like Capita and Liberata. So my concluding points are this, is to say, look, neither the HSE nor local authority regulation is, in my opinion, fit for purpose. HSE have been, and HSE kind of have an oversight role in many respects for local authority regulation. HSE have been complicit in their own demise, I think. I don't want to attack the men and women who work in these agencies. Many of them are admirable, right? They could be earning much more money as inspectors or health and safety officers in the private sector. Right? I've got nothing but admiration for most of those people I've met. But where they're let down by their political masters, our civil servant masters in the HSE, some senior figures in some local authorities, those on HSE board, those on HSE executive committee, and certainly those in central government. And the last point, and most obvious point to make, is that if we do want COVID-19 secure workplaces, that will only be secured by workers themselves. Okay, thanks very much.
Great. Great, thank you very much for that, Steve. Outstanding presentation as ever. Sorry about the screen share problems, but it was put on chat box in the end. We got there in the end, and it will go out. Your presentation will go out with the video and everything. Some outstanding facts and figures there. 1 visit in every 275 years at a possible inspection. It makes a joke of Johnson's comments when he was sending people back to work of just go and have a conversation with your employer, and if you don't get what you want, then phone up the HSE and they'll sort it. I mean, you know, 1 visit every 275 years, and the amount of cuts that you're talking about just shows you what a different world he lives in to the world that we all live in. So yeah, thank you very much for that presentation. I'll move swiftly on to our next speaker now. Our next speaker is Janet Newsham. Janet, well, I'm particularly pleased to welcome Janet to the platform tonight. Janet is from Hazards, an organisation I'm sure everyone on this call will know. Hazards, more than any organisation, I think, has been at the forefront of pushing health and safety issues and highlighting the weaknesses in the current framework of health and safety. I'd urge you to follow Hazards and to read their materials. And I know already, looking at chat box, that the wonderful Hilda Palmer is already putting lots and lots and lots of links up onto Hazards materials. Hazards have been doing tremendous work with Independent Sage on issues surrounding COVID, and I think that Janet is going to talk us through that work and also the Hazards Charter that they've developed. So Janet, over to you.
Okay, thank you very much, and thank you so much for inviting me to speak tonight. So I'll start with the HSC mission statement is supposedly to prevent death, injury and ill health in Great Britain's workplaces by becoming part of the solution. This is on their website. This is what they declare. But their action, or rather inaction, throughout this pandemic has been a dereliction of duty and an abdication. But it's not surprising. After decades, as all the things that Steve's talked about in the decades of cuts to the funding of enforcement bodies, the decades of health and safety being ideologically demonised by governments of all colours, and the HSE and local authorities castrated by reducing the actions they're able to take on workplaces and the strangulation of the effective HSE local authority enforcement, it's incredible that they're still surviving, though it's not been effective for some time. Our health and safety system is broken. The inappropriately named better regulation structures that have introduced business impact targets, regulatory impact assessments, the growth due to the primary authority scheme and the exemption of self-employed workers from health and safety law, and the banning of proactive preventative inspections in the vast majority of workplaces have all contributed to this disastrous response by the enforcement authorities and the lack of protection and control of the risks in this pandemic. And what's the cost? The cost's been the infection of workers, their families and their communities, the kowtowing to business by prioritising their needs above the health, safety and welfare of workers, and the credibility of independent health and safety regulation in shreds. And in the main, it's only when trade unions in workplaces where they're still active and organised that workers' health has been prioritised or even on the agenda. And the press releases by the HSE are revealing, with a pandemic engulfing the workplaces, workers panicking and employers not acting, the HSE on the 27th of March, not until the 27th of March, issued a press release on hand sanitisers. And on the 3rd of April, they issued a joint statement with the TUC and the CBI, and it was a brief, even looked forced, and hasn't been repeated since. Whereas on the 8th of April, the joint statement with the partnership on the health and safety in Scotland was a clarification of how they were going to work together and in their partnerships with FAS, you know, with the government, the STUC, the HSC, businesses, unions, hazards, health, etc., working together. And then on the 23rd of April, the HSC finally issued a statement talking about assembling a team of specialists to assist government on the PPE plan, but no mention of the important role of trade unions or safety reps. In contrast, Northern Ireland HSC, and it's something we've quoted a bit because we looked for risk assessments early on in the pandemic, how we could share those with workers, and they had one on their website as one of the first things. On the 16th of March, they issued a risk assessment to show workers. Oh no, sorry, 26th of March, they put it on the website to show workers what they need to be doing to control the risks, what employers need to be doing to control the risks. On the 16th of March, before that, they issued a statement about contacting the HSC Northern Ireland. So they were encouraging people to contact them with complaints, with issues, unlike anything on the English HSC website. And also there's been more, so it's been more worker focused, more transparent. On the 30th of March, they talked about the number of complaints that had been made to them. There had been a 900% increase in complaints, a high volume of information and advice, etc., etc. Really important, lots of information to support workers and to encourage workers. In contrast, in the UK, no press releases on COVID in May or June. And it isn't until the 2nd of July where they urge businesses to become COVID secure. And on the 16th of July, that COVID is mentioned again, and with the checking of the COVID compliance in Bradford. There's been lots of cases, workplace clusters in between that were never, where HSE were never mentioned. On the 30th of March, the hazards campaign, we wrote to to Martin Temple and to the CEO at the time, Sarah Alban, appealing for the HSC to take action to protect thousands of workers continuing to work in unsafe workplaces, and the need for the HSC and local authority inspectors to continue to regulate and enforce health and safety regulation, in particular to ensure the PPE, the issues that Steve talked about. We said that the response was inadequate, and we followed it up with a further letter which wasn't answered. In particular, we highlighted the risks of precarious workers. And then on the 6th of April, we issued a press statement demanding action by the HSC to save workers' lives. We all witnessed the frontline workers dying from negligent employers and negligent government and the enforcement system, which was at best turning a blind eye to what was going on, at worst was complicit. Hazards campaigners consistently said that there has to be a precautionary approach to the risks as evidence developed about transmission risks and who and how workers who were most vulnerable. Most of what we said was a logical conclusion to what was being presented worldwide, mainly from those countries ahead of us in the infection journey. We all saw the pictures of the Chinese workers in full PPE, taking the precautionary approach to transmission risks, and the bus drivers bringing back tourists to quarantine in the Wirral with no PPE whatsoever. We argued that the lockdown had come too late. Too many workers were continuing to work, even where their work wasn't classed as essential work, and the examples that Steve gave about construction. We witnessed PPE advice being changed to suit the availability, and as a result of hundreds of workers and care residents have died without any interventions by HSC. What more can be a sharp reminder of the HSC's inadequate response to this than the care sector? They didn't visit, they didn't act on complaints, they didn't raise the enforcement notices to protect the staff and residents. This was the case in Leicester, where sweatshops continued to work, and it wasn't until the community were seen to be infected that the government had to act. In reality, our enforcement bodies should have acted months before by identifying where there were going to be problems and who would be at risk, and then compiling a strategy of proactive inspections and COVID-safe certification. The people that should have been enforced in this were nowhere to be seen, and infections amongst precarious, scared workers spilled into the community, and workers and their family members died. Workers' health is public health, as Professor Andy Watterson so eloquently coined the phrase. Bus drivers in London have died because controls were not put in place to protect them. Who would have thought that they were at risk? Anyone with a hint of knowledge about infection spread would have put in place measures to control their risks from the start, and not just when the workers threatened industrial action. The HSC's response has been woeful. They seem to have gone AWOL for most part of the pandemic. Their support for workers has been lacking, to say the least, and the figures show it. And the latest RIDDOR statistics show 9,786 notifications, including 152 deaths, of which they say 85% were in HSC enforced workplaces. The number of notifications made to enforcing authorities fell from 1,183 in week commencing the 26th of April and averaging at 150 per week throughout July and August, though they acknowledge that they're on the increase again. However, I'd add that the information provided by the HSC is inconsistent and lacks transparency. The UK is by no means the worst or unique in its negligence of the risks of people. There are other countries that have that title, but a long and proud history of health and safety law should have made it better for us. The laws weren't changed, they were just undermined by a lack of enforcement and a lack of resources with our enforcement officers. There was a pretense of enforcement with the additional money made, but that one-off cash payment won't fund recruiting inspectors, and in reality, all they've done is set up a privatised call centre without substance and talk of privatising spot checks too. In recent bulletin, the HSC has said that they're carrying out spot checks and inspections, saying that they've contacted more than 17,600 businesses, including site visits and phone calls. They don't make it clear how many have been called and how many have visited, but they conclude that 88% of businesses are compliant and therefore COVID secure, and that they will take immediate action if the business is not. The reality of this statement is that many workers continue to be exposed to transmission risks and their employers are not controlling the risks. In July, Rory O'Neill, editor of the Hazards magazine, contacted the HSC about their enforcement, and the response said that out of 5,466 telephone spot checks completed, only 201 have been referred to site inspection. There were 49 improvement notices issued, only six remotely. No enforcement notices were served. And the recent report by PRC, which advises shareholders of ethical investment, has said that COVID cases in the UK food factories could be over 30 times higher than that reported. We will never know the true work-related deaths, infections or chronic ill health resulting from COVID-19. The HSE have not encouraged employers to register and have resisted investigating many hundreds of them. In Scotland, however, there have been a number of interventions by enforcement bodies which have included 18 prohibition notices and over 300 warnings issued, a far more robust approach than England and Wales. But even there, the dead weight of UK government has left workers exposed to the virus and fatally wounded in many cases. Their multidisciplined approach had included the government, as I said before, trade unions, etc. And they've broadened their approach to include things like roving reps. The Hazards campaign have advocated the independent certifying of workplaces, all workplaces, and that includes schools, universities, hospitals, care homes, construction sites, shops, offices, manufacturing, etc. Because not all employers can be trusted and not all know what to do. All workplaces need to have certified COVID safe, along with low levels of transmission, effective test and trace and isolate. And we've voiced this strongly for months. We have objected to the lack of action on workplace outbreaks and shouted as loudly as we can about the community, about what we can do about the continual demonisation of workers' infections as community-based rather than workplace infections. We produced the joint report with the Independent SAGE in August to provide objectives of how workplaces could be opened safely. The Charter clearly sets out what must be put in place before a workplace is certified, taking a precautionary approach, consulting the workforce and their representatives, and using hierarchy of controls to assess and control the risks. We said that the role of safety reps should be extended to roving reps and linked to commitments for a fair work agenda. The Charter includes more investment in enforcement authorities and for them to enforce the SRSC regs and certify workplaces. Finally, the Charter sets the government challenges to ensure the safety and health of workers by providing funding resources, by providing funding and resources to their communities, and by doing this, they will be ensuring economic stability and health. If the HSE wanted to enforce health and safety law, they could have done so with the right resources, and they should. The law hasn't changed on health and safety, but they've surrendered to political pressure and interference, and any semblance of independence has been wholly squashed by the appointment of Sarah Newton, who would be regarded as the political candidate as the new chair, as she served for 9 years as a Tory MP and minister in the DWP, responsible for HSE. The Health and Safety Executive has the facilities to carry out the research, to conduct experiments, and to provide information about transmission risks, and the controls need to protect workers. But they've failed even to do this, and also to follow the science that is already in the public domain. In September, we wrote to the PHE about transmissions in the workplace clusters, and to date we've had no response to the workplace clusters, but they said incredibly that they didn't have the information on transmission sources. I would have thought that this was a main factor that should have been investigated. Workers have been abandoned, health and safety law ignored, and employers have continued to place workers at risk with hardly any accountability, and the enforcers are almost nowhere to be seen. Our manifesto that we produced last year said that British health and safety system is broken. Workers are harmed daily just for going to work to earn a living, and many now have no realistic prospect of enforcement of their basic human right, a safe and healthy workplace. Unfortunately, this pandemic has proved the statement to be still valid, and the 50,000 people who die each year in the UK as a result of workplaces that fail to control their risks have this year been joined by thousands more. We will continue to remember the dead, and we will continue to fight like hell for the living. Thank you.
Thanks very much for that, Janet. Very complete as ever. Brilliant presentation. And thanks for reminding us of some comparative examples where we can learn that the way we do it here is not necessarily the best way of doing it, and that we can take lessons from what other countries do and from what other nations within the UK do too. So thanks for that information. You quoted from Andy Watterson, one of our health and safety colleagues, who said that workers' health is public health, which is a nice link into our next speaker, who is going to, and Janet, you also pointed out the complete failures of health and safety. That health and safety law fits into a much wider employment law strategy within this country, which has also been failing us for many years. And on that point, I'd like to bring in our next and final speaker, who is Professor Phil James. Phil has been a great friend to the Institute and to me for a number of years. He sits on the Institute of Employment Rights Executive Committee. He has led most of the Institute's health and safety projects over the past 30 years and has agreed to act as a leader on our current project. Phil is going to address the interplay between the failings of our current health and safety system and the broader failings of the UK framework of labour law. So over to you, Phil.
Thanks very much, Carolyn. I understand what it's like now to be in a rock band and come on after somebody who's just blown away the audience. Steve and Janet, their contributions were amazing. And I think mine, in contrast, is going to sound a little more obscure without, because my focus is not so much on the here and now, or even the short-term future, but on a few issues, a few thoughts about where we should perhaps be going in terms of policy. And I just want to touch upon 4 issues. It's going to be very briefly. I hope they sound as though they connect together. I will try and make them connect together. The first issue is to think about how the link between work and health and safety, and particularly health, should be conceptualized. The second issue is, what are the implications for regulation if we take a broad conceptualization of the links between work and health? The third, implications in terms of regulatory oversight and enforcement. The third is, how do we make sure, picking up very much on what Janet's just been talking about, how do we better ensure that that oversight is truly independent? And finally, a very brief word on the notion of who constitutes the regulator. So, okay, on the first issue, the link between work and health, I mean, what we've seen during the pandemic is inequality of vulnerability. This emerges clearly from the ONS data. People in certain occupations, people on low incomes, people in insecure employment have been more prone to be infected, more prone to die, more prone to be hospitalized. But that point about inequality, of course, is nothing new. Epidemiologists have been pointing out for many years that there's gross inequalities in public health, in health. I mean, just to give one very simple example, in a recent study, it was found that the people, men and women in the highest wealth group, lived 8.5 years longer disability free than people, men and women from the poorest group. So inequality of health is nothing new. COVID is though highlighting that point very clearly. The other point that emerges quite clearly from epidemiology is work is an important contributor to health. So if we look at one of my heroes, Michael Marmot's work on public health, I will just read this out because I think it is important. He argues that the connection between work and health can be improved by the establishment of employment arrangements that embody the following: freedom from coercion, job security in terms of contract and in terms of social provisions, fair income, respect and dignity at work, workplace participation, and enrichment and a lack of alienation. In other words, he's drawing out that work doesn't just directly cause harm via accidents, via workplace exposures, it also indirectly causes harm by things like insecurity, low income, and so on. And I think for me, and a point I want to make in relation to this, is what that points to, I think, is perhaps in the future, health and safety regulation being much more embedded in employment regulation more generally, and notions of health being informing employment labour regulation much more. So one implication of that, which brings us to the IER manifesto on labour law, is the question of, should therefore we have a general labour inspectorate, of which HSE is part, perhaps a specialist part, but nevertheless, an inspectorate that's got a broad remit across the field of employment and is about improving standards. And in improving standards, health is one of the critical aspirations, equality of health, as well as the improvement of health. Now, of course, it's all very well setting up a new inspectorate, but as again, Steve and Janet have both pointed out, we have an inspectorate in the health and safety field at the moment. And what that is, and what the HSE has demonstrated during the pandemic is that an absence of resources undermines regulation, but also an absence of will and an absence of leadership undermines regulation. And so I think a really important issue that's coming out of, I mean, it's not a new issue, but COVID is flagged up writ large, is how do we ensure in the future that whether we have we remain with a body like the Health and Safety Executive or we have a labour inspectorate, how do we ensure that that body, there is never a possibility of that body behaving in the way that the HSE has behaved during this pandemic? And if you expect me to sit here in my nice cozy home and say I have the answer, unfortunately I don't, but I have a thought, and I will pass that on for you. And it's an obscure, almost prosaic observation. And this is in 1993, the United Nations adopted what were called the Paris Principles. And this was about the composition of national human rights institutes. And the Paris Principles, among other things, say that these national institutes should be run by, embody a pluralist representation of social forces. So in other words, they are democratic bodies. If government departments are involved, i.e. represented on those bodies, it should be in an advisory capacity. And more widely, that these bodies should have adequate funding that will enable them to be independent of government and not subject to financial control, which might affect its independence. Now, again, that sounds all nice and aspirational, but I would just point out it's not as prosaic as it sounds. So in 2003, the House of Lords Joint Committee on Human Rights actually recommended that the Human Rights Commission, that commissioners and the Commission should formally report to and be held accountable to Parliament, not government, Parliament, and that its budget should be set by Parliament, not by government. And of course, those proposals, I hasten to add, were rejected. But the Scottish Human Rights Commission is actually constituted in that way. So it's not something that's impossible. So, for example, the Scottish Commission on Human Rights, the Commission is not to be subject to the direction or control of any members of the Parliament, the Scottish Executive, or the Parliamentary Corporation. In other words, its constitution is building independence into the status of the body. So I don't know if that's an answer, but I do stress, I think something has got to be done to avoid the farce, and it is a farce that we've seen during the period of COVID. One final thing, and that the issue of who constitutes the regulator, or the enforcer, to be more precise. And I think here it's crucial to bear in mind the fundamental principle, which probably everybody listening in has no problem with. And that is that regulatory oversight and enforcement is not only something that should be done for workers, it is something that workers should be able to do for themselves. And that is not just about being able to inspect. It is not just about roving reps. It's also about them having enforcement powers. That includes things like provisional improvement notices, but it also includes the power to bring private prosecutions. Because that's another fail-safe. Okay, we will try and make sure that the HSE or any successive body has independence, but we can't guarantee that. But let's harness workers and their unions to not only monitor what's going on in the workplace, but if it's unlawful, take action in relation to it. That's all I wanted to say. Over to you, Karen.
Thanks very much for that, Phil. Smashing presentation. I want to live in your future, Will, that's for sure. I think your idea about where enforcement is going in the future is far better than where we are now. I love your UN Paris principles. You know, the idea, well, so that it's the answer there, but you've given there is that we should be regulating the regulators. When we say who is regulating the regulators, it should be us that's regulating the regulators, both in keeping them on the toes and making sure that the funding is there. But brilliant, thanks very much for that, Phil. I know all these ideas will be brought out in our future project when we look at what kind of world of work and enforcement do we want in the future. I think we've got a few minutes left for some questions. So I've been sent some from the chat room. Steve, there's one here from Kevin Myers. He asks, have you mapped the number of inspectors against the outcomes in terms of health and safety incidences, etc.? He goes on to say, he's not suggesting resources aren't important, but what is also important is what you do with the resources that you have. And he's very much in favour of your comments and Phil's comments there that say about the important role of workers and, of course, the responsibility on employers. I'll throw another one in before I go back to you. Pet Cairo says comments on classrooms, and they're getting colder as windows and doors are left open to increase ventilation during COVID issues, and that the HSE is very weak on minimum temperatures. And asks, are you able to give any helpful advice on that? Should we take those two first and see where we get to? Steve.
Yeah, thanks, Karen. Thanks for your comments and questions. On the first point, which is about the relationship between the kind of inputs, the resources that the regulators have, and then the kind of the outcomes. Yeah, look, it'd be wonderful to be able to do that mapping. We simply don't have the data that makes that even vaguely feasible. So, you know, you would need, in terms of the outcomes, you would need usable data on, and I mean data across sectors at least, not just individual workplaces, obviously, around, for example, near misses, dangerous occurrences, reportable injuries, instances of ill health, and also deaths. As well, and even deaths we don't adequately count. So we simply, as a society, we simply don't have adequate manageable data about any of those kinds of phenomena that I've just pointed to, which are outcomes of poor health and safety at work. So I mean, the mapping would be lovely, but we simply don't have much of the data that we need to do that. What I would also say about that, just bear in mind what I've just said, we don't even have adequate data on deaths at work, right? It's something that I've been working on for many years. I know Hazards has been working on for many years as well. And that, for me, tells me something about our society, because, you know, you can tell something about societies by what they count. And we don't bother to count adequately the numbers of people who get killed through going to work. So I think that's just an aside. The other thing I would say, Kevin, is that, yeah, look, I mean, you know, we can argue about resources and outcomes. There is a point, though, I think, where any system of regulation depends upon at least a minimal credible level of enforcement. If a law can't be enforced, it's not, the legal regime of which it is part isn't credible. And the fact that many workers never ever see an inspector in the course of their working lives, I think is and are less and less likely to do that. Is an indictment of our system of health and safety inspection. On the point about classrooms, I mean, I struggled with this in when I taught in a regular university in terms of trying to kind of enforce or maintain minimal levels of temperatures, and I always struggled with that unsuccessfully, because HSE again weren't helpful. It depended upon the strength of the branch, and depended on the strength of other workers. But I mean, Janet, I don't want to kind of just put you in a frame, but you might be more useful in terms of just coming in on this, maybe in terms of the efforts of Hazards around in this area.
Yeah, well, I mean, there's a whole load of issues around classrooms, and not least, you know, about the transmission of the virus and the aerosols that are being produced. So so people are opening windows and doors to make sure that they're ventilated, and really they're going to have to start looking at replacements for those as winter draws through, and with mechanical replacements if we've still got the transmission of the virus so high in the communities. I mean, the idea is that we get the transmission low, and therefore people are not going to be as exposed. But it's not just in classrooms, it's in all workplaces. What they have to look at is proper solutions to this issue, making sure that there's proper, that there's adequate ventilation in some way, and probably in a mechanical way. And that temperature is about the fact that people are keeping, opening the windows and doors to improve the ventilation.
Thanks, Janet.
Thanks, Janet. I think there was information put on the chat box as well, so we can send that out with the video. There's another one here that's interesting. Somebody asks, the unions sit on the HSE's board. Does that mean that unions are complicit in the failures? Now, you know, it's like working on a works council, isn't it? You can be outnumbered and therefore you don't necessarily setting the tone. Are you better to be in and putting your two hemneth in, or does that make you complicit? Any thoughts on that? Phil?
It had to be me, didn't it? It's a very interesting question, because I've been asking that question for 10 or 15 years, I think. And I've never had an answer that really explains why the TUC in particular seems content to stay involved. I'm trying not to upset. Okay, I'll give my personal view. I would have thought that we have got to a point where the TUC needs to seriously consider its position. And in fact, the trade union members on the board, officials, need to consider their position. But, you know, that's just my personal view. I'm sure if somebody from the TUC was here, they might well come up with a perfectly valid argument to the contrary.
Well, we have
I find it difficult to see.
We have the TUC Health and Safety Officer speaking at one of our future events, so tune into that, everybody, and maybe we can put the question there too. Can
I just, in relation to Kevin's question you asked earlier, can I just make a couple of quick observations? I'll make three quick ones. Yes, clearly issues of efficiency are important. You use your resources as best you can. Secondly, Steve's point, when resources get below a certain level, I think credibility goes out the window. But thirdly, no, we don't know how efficient different things are, but I'm not sure the HSE does either. I was reading something the other day, because nobody has the data. And finally, one of the big problems is that when SSP came in, we lost a lot of social security data on accidents at work. So in a way, this is intimately tied up with the whole issue of sick pay and how we provide sick pay. Okay, I stop.
Sorry, folks, I think Cad dropped out. She's just in the process of coming back in.
All right. Okay.
Sorry about that. I don't know why I keep dropping out of the Zoom, but I am back. So I missed a little bit of that, Phil, but sorry about that. Anyway, I've come back, and while I'm in here, it might be best to, at this point at 8 o'clock, to just do some final comments. So first of all, just to say thank you very much to all of our wonderful speakers for bringing your insight and your knowledge and your experience to this Zoom. As ever, it is very much appreciated. Thank you to all those who've joined us, both on Zoom, participating in the chat box, but also on Facebook and Twitter, those who have been on our live stream. If you've enjoyed this event, don't forget to sign up for our Institute of Employment Rights newsletter and the hazards onto the hazards site too. There'll be a final slide coming up soon, which will give you all the information. It's got a great link to a lot of our publications. It gives you the links to our contact details. So do sign up, get the reading. The final cut of this video will be sent on our website within the week or so, along with any materials that have been submitted by our three brilliant speakers. So our next two events, I'll just say that finally before we leave, our next two events are on equality in the workplace, and we'll cover a whole host of issues. So sign up for the news brief, get an early warning about when they are, and we hope to see you there. So thanks again to our speakers, thanks again to everybody, and we hope to see you at the next event. Bye bye.